The Morecambe Bay Investigation was set up in 2012 in response to some extremely serious quality failings within the Trust. The report was produced in 2015, but even in advance of the report, it became aware that we had failed the public and we needed to make some significant changes in the Trust to improve the quality of our services, not just in maternity, but right across the whole workings of the organisation.
There is a great deal for other organisations to learn from what's happened here, from the legacy of the lives lost, because we had so many things wrong as an organisation.
When the truth started to come out and we found our involvement, it was shock. It was very upsetting. We had to relive something that we thought that we'd worked through, and although the pain never left us and we always thought about her, you move on, you do. It's a natural grieving. So to then go back and find out things that we had no idea, it was upsetting. But then working with the Trust to get to a conclusion from it, that was quite helpful as well.
We were very, very determined that we were going to demonstrate to the families that we were listening, that we were very, very determined to make sure that this would never happen again.
But this has been a huge change programme. We've got a completely redesigned governance system, we've got much better training and education, we've got a stronger workforce, we have more staff than we did before, we're improving the estate, and we've developed really strong strategic partnerships with other organisations so that we can work together for the benefit of patients. I think through the years covered by the Kirkup Report, we lost the trust of the public, and we are working now very hard to rebuild that trust. And part of that is engaging at all stages in the development of our services with the public, with the users of our services, and with people who've used the services in the past. So they're part of our governance structures, they're part of our project teams, and they work with us and our regulators to feed back as to how services are developing.
The care I received with my second baby was very good. I felt very supported, very cared for, and would say that it was a positive birth, which was a good experience, because I'd been very, very concerned about having another baby after my first baby.
Thank you for all the contributions that you've made, the ideas that you've given us and the suggestions you've made.
Where we develop guidelines now, we have service users on our guideline group that help us to do that. They've also helped us to write job descriptions for key roles for midwives and consultant obstetricians. They've even shortlisted the candidates in respect of those posts, and they've sat on interview panels and been part of focus groups as part of that recruitment process. In amongst all of that, they've also been very much part of the quality assurance visits that we undertake throughout the services, specifically something called 15 Steps, which is about how a woman and her family can ascertain within the first 15 steps of walking into our services what kind of care they're going to receive. So it's been really important to get their feedback.
I've been involved in quite a few things. The biggest part really was the Kirkup Implementation Committee, where we went over policies, rewrote policies, job descriptions. There is no greater way of showing somebody and proving that that things are changing and things are different than being there and watching the trust grow and move forward.
Working with some of the families who we've harmed in the past has probably been the single most humbling experience of my career, and their ability to help us to move on has been quite inspiring.
So I think one of the principles that we've learnt through the last 5 years is co-design is really important. So we were really clear when we received the recommendation from Kirkup for the new maternity unit here at Barrow, that The community needed to be involved in developing that maternity unit so that we could be absolutely certain that it met their needs and their wishes alongside that of our frontline staff.
And we've incorporated that thinking into our designs. We've had architects and estates workers working directly with users of the service to plan the structure and the design of the new services so that they better reflect the aspirations of the public.
They've asked us about everything that we wanted to see in a new maternity unit, and all the things that were really important to us as families that had been through what we'd been through. That was all taken into account and we were listened to, and what they came back with was more than we could ever have hoped for, to be totally honest with you. The input they've taken from the families as well as the wider community with the engagement has been it's our maternity unit. It's not the hospital's maternity. It's like they've given ownership back to the people, to the community.
I think this was an enormous change programme. It affected the lives of hundreds of people within the organisation, and really this work couldn't have been achieved without the hard work and commitment of individuals, not just from the maternity service, from obstetrics and gynecology and midwifery, but also from other related specialties like paediatrics and anaesthetics, who have made a fantastic contribution to the future configuration of services.
Oh, good girl. There we go.
One of the biggest things that's happened, I think, and has been championed by a chief executive is the listening into action, which really puts the change and improvement at the heart of everything we do at a local level. And the changes are led by our frontline teams, and as executive directors we sponsor those changes in order to ensure that if there are any boundaries or barriers to improvement, we help to remove them.
Having heard what I've heard, if you know that someone is listening to the concerns that you have, people will just keep on bringing them forwards all the time. And so much now, the way the systems are, that ideas for whether it's saving money or providing better care or doing research, it all comes from the people on the ground, because everyone knows the people who do the job day to day are the best ones to come up with ideas. And definitely now, those ideas are listened to further up.
The Kirkup Report focused on a number of major issues, but perhaps the most important of those was the culture in the organisation. There was a very clear steer from the report that we had to develop what would be a learning, developmental culture, which wasn't present 5 years ago. And that means individuals learning together, training together and working as teams.
The Kirkup Report identified that multi-professional teams weren't working together well. They weren't planning women's care with women as a multi-professional team.
Team working is important for any organisation, but it's essential for a profession like ours, because otherwise if you don't have an effective team, it can be catastrophic to the patient care and it can be very demeaning to the individuals.
Our doctors, our midwives, our nurses learn together, our allied health professionals, not just in a classroom environment, but actually in reflecting on incidents, reflecting on things that we could do better. And indeed, every Wednesday morning, we discuss all of the harms or potential harms that have happened in the previous week.
All these meetings allow us to discuss what had happened within the short period of time, and if we had done it well, we've done things well, or we need to change things if such a situation happens in future. These are very much unlike what used to happen in the past, whereby we doctors will have our own meetings, the midwives will have their own meetings, and we didn't communicate as well as we should have done, but we do now.
We get trained with the people that you're actually working with in emergency situations. So we have what's called a prompt day. So on the prompt course, when you would have possibly emergencies such as somebody bleeding, you now do that training with the same doctors that you'll be working with on the labour wards and whatnot. So that really helps everyone understand their roles much better, and it helps the communication, and it has been really successful.
Well, I think there's now very good evidence that when things go wrong, individual human characteristics can play a key part in that. And so by enabling people to focus on those individual factors, to surface them, to learn how those factors can change and can be amended over time, we can hopefully improve the quality of our services and the safety of the services that we provide to patients. So we've been working not only with human factors experts within the organisation, but also our teams have been going out to human factors experts to other organisations with our strategic partners and learning alongside those individuals to gain the expertise from that organisation too. One of the ways that we ensure that everybody behaves in the way that we would expect is to establish a behavioural standards framework. And the way we did this was we asked all of our staff, how do you think others should interact with you? How do you think people should behave towards each other in the organisation? So rather than being a top-down imposition of values or behaviours, this was from the bottom up. How would staff want to be treated in an organisation? We think that'll improve safety and effectiveness, but we also think it'll make this hospital a much nicer place to work.
The ethos now within the maternity unit is one about we all have a very important role to play, but it's not to the exclusion of the other professional groups. And in order for women to receive the best care from us, we absolutely need to be working together to ensure that happens.
Well, it's essential to have a properly trained workforce if you're going to deliver high quality services. And the Kirkup Report clearly indicated that our approach to training had not been robust enough. What we were looking to do was to make sure that every individual working in our organisation not only had the mandatory training required of everybody, but also had the role-specific training specific to the role that they were due to undertake within the organisation, and that we had very good monitoring to ensure that that was complete and that it was monitored on an annual basis and was part of their appraisal and revalidation processes. I think one of the first things we did was to introduce an electronic training and management system. This enabled us to track exactly how much training people had undertaken in which specific areas, and it means that at the press of a button an individual can determine what elements of training they have completed and what is left to do, but also on an organisation-wide basis or a division-wide basis we could see what the weaknesses or strengths of an individual division or organisation were.
I think it's very important to avoid professional isolation. We're on the edge of a very large region, and once you're a consultant, you're in post a number of years, there's the potential for things to change that you don't keep up with. We've got a number of measures to avoid professional isolation here, but I think the strategic partnership's an important strand in that.
So developing strategic partnerships with two other organisations enables us to share learning about things like audit and protocols, to share information about how we manage patients, but also to enable individuals from one organisation to go and work in the other organisation and see at first hand how they practice medicine.
I attended Central Manchester's Audit and Clinical Effectiveness Day, and there was a series of high quality presentations. Brought away a thought for how we can make sure our guidelines are meeting women's needs to the best. They also presented a never event, a serious case where something had gone wrong. So I was able to QA our own processes against what's going on in one of the leading hospitals. What we're going to start doing now is go to some of their complex clinics and also to their labour ward, take part in their handover and their ward round and look at team relationships, prioritisation, and all that human factors stuff.
My question to other organisations is, have you read the full Kirkup report? Have you actually assessed where you think you are against all of the recommendations in there? So if you looked at the recommendations for us, for Morecambe Bay hospitals as an organisation, have you looked at within your own organisations how you think that you actually look in comparison? Have you discussed this in your own organisations? Has it been to your board with a gap analysis? Have you really recognised how close your own organisation could be to what happened here? It's so important that the learning from what we got wrong is not kept within our organisation alone, but is much more widely viewed, and that other organisations can learn from that. It's so important that we never let this happen again.
So what we see in all the forms of feedback that we get from women is that their patient experience and their experience in our services is improving all the time, and that their clinical outcomes are improving too. But what's really important is that we recognise that we still have areas of improvement. We will always strive to improve further, even when we are getting it right in some areas.
It's beautiful. Hello.
I think the services are now unrecognisable from a period of 5 years ago, but we haven't finished yet. This is only part the way along the road. So in 5 years' time, we will have even better services here at Morecambe Bay.